Obesity is a growing problem worldwide. It means having too much body fat. This is not just about looking a certain way, it's about serious health risks. Many people struggle with their weight, often due to lifestyle factors like poor diet and lack of exercise. Genetics can also play a role. Obesity increases the chances of developing other health problems, including heart disease, stroke, and certain types of cancer. Type 2 diabetes is another serious risk. It is crucial to address obesity by understanding its causes and taking steps to prevent it. Making healthy choices can lead to a longer, healthier life. Obesity and type 2 diabetes are closely linked. When you carry excess weight, your body becomes resistant to insulin. Insulin is a hormone that helps your body use glucose or sugar for energy. Think of insulin as a key that unlocks the doors to your cells, allowing glucose to enter. Obesity is like rust on those locks. The key, or insulin, struggles to work properly, and glucose builds up in your bloodstream. This is called insulin resistance. Over time, it can lead to type 2 diabetes. The pancreas, which produces insulin, works harder to compensate, but eventually it may not be able to keep up. The good news is that this process can be reversed. Losing weight and making healthy lifestyle changes can improve insulin sensitivity and reduce the risk of developing type 2 diabetes. Insulin resistance is like your body sending you a warning signal. It's a sign that your cells are having trouble using glucose effectively. This is often linked to a diet high in refined carbohydrates and sugars. When you constantly consume these foods, your body is flooded with glucose. Over time, your cells become less responsive to insulin. It's like your cells are saying, "Enough is enough, we can't handle this much sugar." Ignoring these signals can have serious consequences. Insulin resistance is a major contributor to type 2 diabetes, heart disease, and other health problems. It's crucial to listen to your body and take steps to improve insulin sensitivity. Metabolic syndrome is not a single disease. It's a group of conditions that often occur together. These conditions increase your risk of serious health problems. Think of it as a warning sign that your metabolism is out of balance. These conditions include high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Having 3 or more of these conditions means you have metabolic syndrome. The good news is that metabolic syndrome is often preventable and treatable. Lifestyle changes, such as losing weight, eating a healthy diet, and getting regular exercise, can make a big difference. Section 5. Unmasking fatty liver disease, or NAFLD. Non-alcoholic fatty liver disease is a condition in which fat builds up in the liver. This can lead to inflammation and damage over time. It's becoming increasingly common, often linked to obesity and insulin resistance. Imagine your liver as a filter. When it gets overloaded with fat, it can't function properly. This can lead to scarring and eventually liver failure. The good news is that NAFLD is often reversible in its early stages. Losing weight, even a small amount, can significantly reduce liver fat and improve liver function. Section 6. Recognizing the warning signs, symptoms to watch out for. It's important to be aware of the signs and symptoms of these conditions. Early detection and treatment can prevent serious complications. If you experience any of these symptoms, consult your doctor for proper diagnosis and management. Type 2 diabetes, increased thirst, frequent urination, unexplained weight loss, increased hunger, fatigue, blurred vision, slow healing sores, frequent infections. Metabolic syndrome, a large waist circumference, high blood pressure, high fasting blood sugar, high triglycerides, low HDL, or good cholesterol. NAFLD, often no symptoms in the early stages but may include fatigue, abdominal pain, loss of appetite, yellowing of the skin or eyes, also known as jaundice. Section 7. Breaking the cycle. Practical tips for prevention. Preventing these conditions is often within your control. Here are some practical tips to make a positive impact on your health. Maintain a healthy weight. Losing even a small amount of weight can significantly reduce your risk. Eat a balanced diet. Focus on whole, unprocessed foods like fruits, vegetables, lean proteins, and whole grains. Limit processed foods, sugary drinks, and unhealthy fats. Stay active. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Manage stress. Find healthy ways to cope with stress, such as exercise, meditation, or spending time in nature. Section 8. Fueling your body foods for a healthier life. Choosing the right foods can make a big difference in preventing these conditions. Here are some foods to include in your diet. Leafy green vegetables. Spinach, kale, and collard greens are packed with nutrients and low in calories. Berries, blueberries, strawberries, and raspberries are low in sugar and high in antioxidants. Nuts and seeds. Almonds, walnuts, and chia seeds are good sources of healthy fats, fiber, and protein. Fatty fish, salmon, tuna, and mackerel are rich in omega-3 fatty acids, which are beneficial for heart health. Whole grains, oats, quinoa, and brown rice provide fiber and nutrients. Section 9. Embracing a healthier future, exercise, balance, and longevity. Living a healthier life is about making sustainable changes. It's about finding a balance that works for you. Remember, small steps can lead to big results over time. Find an exercise you enjoy, whether it's dancing, swimming, or hiking. Make exercise a part of your routine. Listen to your body. Pay attention to your hunger and fullness cues. Don't eat if you're not hungry. Don't deprive yourself. Allow yourself occasional treats in moderation. Be patient and consistent. Healthy habits take time to develop. Don't get discouraged if you slip up. Just get back on track. Remember, your health is your most valuable asset. By making healthy choices today, you're investing in a longer, healthier future.